my name is Kayla. I will be demonstrating on how to do a piggyback medication. I'm in Professor Lloyd's Adult Health 1 Term 2 class. So before I begin, I'm going to make sure that I implement standard protocol. I'm going to go ahead and check my physician's orders with my MAR, making sure that I've got the right patient and the right medication. My doctor has ordered 1 gram of vancomycin according to both the physician's order and the MAR. Available, I have 1,000 milligrams per milliliter vancomycin. So that means, according to my calculations, I'm going to need 1 milliliter. So first I'm going to get an alcohol swab to clean the top of my medication bottle. So I'll take an alcohol swab and clean this top of the bottle. Okay, next I'm going to go ahead and get my medication. Once again, I need 1 milliliter of vancomycin because the order was 1 gram and I have 1,000 milligrams per milliliter. So I'm going to go ahead and take this back to the 1, insert that here into my bottle, flip, and pull. Push that back up. Okay. Now that I have my medication, I'll go ahead and just put that lid right back on there. Next, I see that for a piggyback, you have to infuse your medication into normal saline. I did already check that the white blood count was elevated, so vancomycin is needed. I also checked that the primary that's already hanging for this patient and the secondary that I'm hanging is not going to affect one another. So next I'm going to go ahead and inject my medication into my bag. So I'm going to go ahead and take my alcohol swab once again and clean the port. Take my lid off and puncture that and squirt that medication in. Okay, once the medication is in, I'm going to go ahead and mix up the bag and put my label on it stating the date, time, the medication, patient, the route, and my initials. I'm also going to get my tubing for my secondary bag and label it with the same things: the date, the time, the medication, dose, initials, and the patient's name. So next I'm going to go ahead and take my alcohol swipes, my gloves, my tubing, and my medication and hanger into the patient's room, as well as my medication card and my MAR and physician's orders. Hi, my name is Kayla. I'm going to be your nurse today. Can you go ahead and tell me your name and your date of birth? Thank you. Do you know if you have any allergies to vancomycin, latex, or alcohol? Very good. Well, your doctor has ordered you vancomycin 1 gram for your, it seems like you're having the infection. Your white blood count was a little elevated. So I just want to teach you about how vancomycin has a few side effects. It can cause ototoxicity, which can cause diminished hearing. So if you have that symptom, we would like for you to let us know. Also, it causes red man syndrome, which is, it causes you to be red and itchy. So if you have that as well, please let us know. So now I'm going to go ahead and wash my hands and check your site. First, I'm going to make sure that it's red and not too tender. There's no inflammation or edema or anything. And now I'm going to re-wash my hands and place on my clean gloves. Next, I'm going to go ahead and make sure that your primary line is running. And it is. Good. Okay. Okay, next I'm going to take my alcohol swab and clean the port closest to the primary bag. With this, I'm going to be priming my secondary bag. So for priming my secondary bag, I'm first going to make sure that my line is closed, and I'm going to take off my sterile lid and attach it to the primary line. So that's screwed on tight. Next, I'm going to go ahead and make sure the lid's on and open up the line. Make sure there's no bubbles, anything of that sort. And when this is filled halfway, I'll close the line back. Make sure that's primed. So now I'm going to go ahead and hang my medication. That's labeled for my patient according to my physician's orders and my MAR. I'm going to go ahead and clamp this, make sure this line is clamped. Now I'm going to go ahead and spike the bag. I'm going to take off this sterile dressing. I'm going to take this off to be able to spike the bag so that we don't get our medication out. So I'm going to take my spike and spike the bag. Because it's clamped, none of the medication is being lost. And I'll go ahead and re-hang my bag. Now I'm going to go ahead and hang my primary lower than my secondary so that the secondary will infuse.
I know, it's so intense.
And while I open my line, I'm going to be calculating that the medication will drop at 17 drops per minute according to my calculations.
It's like you have to outshine everyone, but
And having the line open so that both medications are now infusing into the patient. Now I'm going to go back to my patient and make sure that the site is not red or swelling. There's no tenderness, and see that the patient has definitely taken the procedure well. I'm going to go ahead and document the date, time, medication, route, site, and patient's reaction to the treatment, and also to the teaching of the medications, and the INO, and also my initials. Thank you.